everyone, welcome to another episode of our Wellness Exchange series. My name is Diana Hualpa with the Hidalgo County Wellness Program, and today I'm here with Dr. Rudy Alvarez from South Texas Health System. Thank you so much for being here, Doctor.
Thank you for inviting me.
Well, today's conversation is going to be about the long-term effects of COVID-19. But can we start on what is exactly COVID-19, Doctor?
Well, thank you for having us. And I think a presentation like this is very important to give access to individuals so that they can know what's happening in COVID, and that's our first battle, just the education, where we're at, and it's important to have these discussions. So what is COVID? It was a new type of virus that we definitely didn't have immunity toward. We didn't have any vaccines or drugs. That's why we called it the novel when it first came out. It primarily affects the respiratory system, which is why we were doing social distancing. The masks are effective, but we were concerned about high contact surfaces and cleaning those surfaces so that we don't contact our eyes, our mouth. So those are the transmission routes of the virus. So the preventive measures that we took were physical, social distancing, and quarantine. And this diagram that we'll have for you just kind of shows all the interventions that we did, how you could get it in close contact and airborne, and how long it can last in the air. So in terms of symptoms, they're very broad: fever, headaches, fatigue, muscle aches. So it was very hard for us to distinguish that from any other types of infections or even allergies sometimes. So that created a degree of panic. Do I have COVID? Do I not? What's happening? We were learning about this virus. Very new, very different, but some of the consequences were very severe. Some of the individuals were forming blood clots. So we know that, and I'll go into a description of why that happens, but essentially what was happening is the lungs are an area where the virus infects first, and it goes into our cells. It takes over our DNA, and it uses our DNA and all the machinery of the cell to start replicating itself. The immune system will come in, it will try to identify it, respond to it, and that same inflammatory response leads to an overreaction that we call the cytokine storm, and that damages blood vessels. So those symptoms were leading anywhere from blood clots to clots in the brain as well, people having strokes, and some of the long-term effects that we may see maybe as a result of those.
And I think one point that it was very interesting that you mentioned how the quarantine, especially here in the Valley, we do have those multi-generational homes, so definitely affects, even though those asymptomatic patients may be feeling well, it definitely had some effects to the other patients that were living there at the same home. So
certainly those are things that we've learned, that hard lockdowns and shutting the entire economy can have its benefits, but I can tell you, when we were in the hospital and everything had shut down, we essentially ran out of equipment. We ran out of masks because everything is connected. And this thing about some are essential and some are not essential is very difficult, because all the industries are connected, and even though the hospital is an essential place, we could not do the surgeries, we could not identify even tools to work. Within the laboratory, we're running out of reagents to run the tests. So it's very difficult to do an effective quarantine, and in the future it will probably be a modification of what we've learned today.
Based on this experience. And what are some of the risk factors that you notice based on the patients that experience COVID-19 that lead to those severe symptoms or complications like the blood clot that you were mentioning, or the stroke maybe?
So definitely some of the risk factors and complications is having older individuals. We noticed that as we got above 60, 70, and most definitely 80, those individuals were at highest risk. Our immunity tends to go down with time. The production of our antibodies and the response is lower. So in those individuals, they had the highest risk. but the CDC put out a list. I'll reference it here, and it includes those with asthma, cancer, chronic kidney disease, chronic lung disease, dementia, diabetes, heart conditions, liver disease, excess weight, smoking, stroke history, substance abuse. Any of those have risk for severe complications. And I can tell you there's other interesting facts. The interesting statistics is that up to 1/3 who are infected did not develop any meaningful symptoms. Some blood types, like blood type O and B, have a lower risk of being infected and having severe COVID.
Well, that's very interesting.
Yeah, interesting facts. We don't necessarily know why.
Yes.
And then blood types A and AB have more severe infection.
Wow.
So our understanding of the reasons for this is not completely understood, but we do have some facts that have arisen from this.
And for example, based on the list that you mentioned on the underlying medical conditions, we do see those chronic conditions that keep being one of the key risk factors, right? Like obesity, diabetes, and hypertension, which are also something that we know we have a high prevalence here in the Valley as well. So.
Yeah, not just in the Valley, but in general, in more affluent countries, in Europe, in the Americas, we tend to have more of those conditions that predispose the heart disease, high blood pressure, the chronic conditions certainly do increase your risk of having more severe symptoms.
Can you elaborate a little bit more on those long-term complications from COVID-19?
Yeah, so the long-term complications we still don't completely understand. We're describing it as long haulers. We're sometimes saying it's long COVID. It's been those are synonyms for it, but anybody who still has symptoms after 4 weeks is the first thing that we start to describe as a long hauler or long COVID. Those may be residual effects, anything from having fatigue or having shortness of breath. Some of these may be actual changes that happened in the body. For example, if they had pneumonia, they could have complications such as pulmonary fibrosis. Some had blood clotting in different areas of the body, like the kidneys can lead to renal failure. Some had strokes. Most of the residual disease usually leaves by 12 weeks, but some people are having an even longer duration of those. And it doesn't necessarily mean that if you had mild disease, you won't be having these situations. We've seen these conditions in those who had mild disease, but they're more prevalent in those who had severe disease. So the NIH described this in February 2021. Symptoms can last weeks or months and can appear even if illness was mild or severe or were asymptomatic. So tiredness, fatigue, difficult thinking. Some people may describe that as brain fog, headache, loss of smell or taste, dizziness, understanding, fast beating heart, chest pain, difficulty breathing, cough, joint or muscle pain, depression or anxiety. And this is not the first time that we've had these symptoms. We actually had this with SARS-1 pandemic as well. So what we call a post-viral symptoms. So we know that this is just far more spread and more people are describing this. If you approach your physician about it, physicians are barely starting to notice these things. So it's an understanding even amongst the medical community that we're not very well prepared to treat, but every day we learn more. It's just, as you can see, it's just being described this year.
Yes.
And we're learning more about these conditions. They may linger, and we may need to follow up with multiple visits until we see improvement.
Yes, definitely. And one of the things that I found very interesting that you mentioned is that regardless of how severe the symptoms were of COVID-19, there's still that possibility of those patients developing those COVID-19 post syndromes or post symptoms. So I think that's really interesting because usually, and that might be just my understanding or my general opinion was like, okay, if I did have these severe symptoms, more than likely I'm gonna be the one that has more complications long term, but not necessarily, which is something really interesting.
Yeah, not necessarily. It varies by individual. We know that females tend to have less severe disease, but they tend to be more affected by long COVID symptoms. There's different coping mechanisms of dealing with these. Some people may notice that their symptoms linger, or they might not improve after leaving the hospital. So it varies by individual. Just like sometimes we don't understand how some individuals that were elderly and were infected with COVID didn't really have much in terms of symptoms. Mm-hmm. It doesn't always fit the textbook for every patient.
Yes, and like you mentioned, it's always visiting with the PCP, making sure that, because every case is different, so it has to be treated in a personalized way.
One thing I wanted to also add is we still don't know the incidence of this. We don't know how frequent it is. People are describing it, but we don't have an idea. Some suggest that 20 to 30% with COVID experience symptoms longer than a month, and the incidence is declining over time as people are slowly recovering. But the majority of people who were hospitalized are experiencing symptoms. Most of the symptoms are fatigue and muscle weakness, which is 63%, sleep difficulties, 26%, anxiety or depression, 23%. And then the cause of why some recover within 2 weeks and other they don't recover until a few months later. We're thinking it's because of the direct toxicity that the virus caused, especially in the lungs, the ongoing inflammation. You can have ongoing inflammation even after you haven't been infected, and that inflammation can lead to continuous damage, especially to the blood vessels. So the vascular and injury, and so the vessels carry the blood, which gives oxygen to our tissue. So that is a contributing factor, and that's something that we didn't see before in other viruses. That vascular injury and ischemia. Ischemia just means lack of oxygen to that organ, caused by the virus, so leading to blood clots.
Very interesting. And you did mention about anxiety and depression being some of those consequences of the COVID-19 pandemic. Would you be able to elaborate a little bit more on that? And maybe, because of course, the social distancing, the having to stay at home, the quarantine definitely had an effect.
Absolutely. So those are more difficult things. You know, when it comes to medicine, where we can describe the injury, and sometimes the mental effects are so much harder to identify and to deal with. And the factors, the age, the gender, the marital status, the social group that people are under is all different. So how one person copes with it is different from another. But we do know that the long-term stress on individuals is not good. After natural disasters, we're seeing the same types of symptoms now, but usually a natural disaster or financial crisis ends at some point. What's so different is this has been so prolonged, and its effect has been far-reaching. There's nobody that hasn't been touched by this. The individuals that have been affected by this is pretty broad. So people may have a high burden of mental health problems. They may have depression, anxiety, stress, panic attacks, irrational anger, impulsivity, sleep disorders, emotional disorders, post-traumatic stress syndromes, suicidal behavior. They tend to follow major economic crises, but this is unique because of the scope and the duration. So this is really a psychiatric epidemic, and it's a co-occurring with a COVID pandemic. And it's an intervention that we need to realize, we need to talk about in these forums. People need to feel like they're not alone, not unique. And we need to have public health interventions. This information needs to spread that sleep is good, social interaction is good, and everything that we took away from individuals. We basically said you have to quarantine, you have to be away from your family, your friends, and people feel guilty. I mean, if I go see my mother, am I gonna give her the virus and kill her? They're elderly. Most have not seen their families, most did not get to see individuals when they were dying in the hospital.
Or in the funerals,
or
right?
in the
They
funeral.
didn't even get that opportunity.
So we're very social creatures that need each other, need that interaction. We need to lean on each other, and that's something that's been taken away, but is slowly coming back. But identifying those instances, seeing that we're all vulnerable to that. I saw it in the hospital. Healthcare professionals undergo the same thing. There's a lot of turnover, the stress. Everybody has a breaking point.
Exactly.
And then there's a lot of factors that are associated with how people cope with those mechanisms. Age. Young individuals don't cope as well as older individuals. The gender can also affect it. In some of the studies, there was more of the females were affected, but sometimes it can be biased because males won't readily
go to the doctor, express that they have
express
symptoms.
that. Absolutely. The marital status, the occupation, the exposure to COVID news. Actually, the more you were on social media, the more you were reading about COVID, that was seen as a negative factor affecting health. And so a platform like this, improving access to information and mental health resources and prioritizing and integrating that into primary care are some of the mechanisms will do it, that will help us get back to normal. But as we're slowly transitioning back, we're seeing an improving model. But there are certainly tools that we can use to promote mental health.
Yes, definitely. And it's such an important aspect of health. It's just such as important as physical health, definitely. And as you mentioned, it is something that is going concurrently. So we do need to prioritize both and make sure that people feel comfortable talking about how they feel. And like you mentioned, they are not unique, or the way that we feel is not exclusive to us. We are in this together. It has been a difficult time. Before we started recording, we were talking about how different last year was. So it definitely has been a challenging year, very different to what we were used to it. So definitely is talking about mental health and discussing how these can also have some consequence, because of course we know that you did mention about suicide rates and all of that. So definitely.
So we've seen the suicide rates, depression rates, anxiety. We see it on the news right now. People are fighting flight attendants. There's less of a threshold. People are tired. They're anxious. When you're most stressed, you're unlikely to put up with much. So some of the recommendations that we're giving is get back in touch with family. Find those things that you enjoy. We do recommend physical activity. That has been linked as a decreasing or as a factor that decreases depression. So getting out, moving, getting fresh air, healthy diet, absolutely. Avoiding alcohol and drugs. Alcohol injures or is an adverse effect. We saw alcohol sales go through the roof. But that's a coping mechanism for some individuals. And that's the way they cope. So we recommend good sleep. Sleep is triggered also to the immunity. I'll show you a graph on that. Participating in social activities, because we're social animals, and we need activities that benefit our moods and the moods of others, and pursue other beneficial activities, whether it's listening to music or getting out and seeing nature, going to the beach, getting that sense of going back to normal and feeling like the world is not falling apart.
And actually here with the program that we have here in the county, we definitely always want to promote those healthy lifestyles, which are part of everything that you mentioned, the healthy eating, the exercising. Those are things that we do need to do on a daily basis so we can see the results, and it definitely has some instant effects as well. For example, the exercise.
Exercise releases endorphins, it releases a lot of the catecholamines that give you energy, that make you feel refreshed. I've gotten away from that as well, but when I used to run, they call it feeling the runner's high, but any aerobic activity, not necessarily lifting weights, it's got to elevate the heart rate. So whether it's a fast walk, whether it's an elliptical, whether it's a swimming pool, get out there and move.
Yes, definitely, and it does help to feel energized. And also, you did mention about being in contact with nature like that. Definitely, as well helps. So, you were going to show me a graph regarding sleep, right?
So, sleep loss. That's something that many people don't really think of too much. They might say, "Well, I don't need that much," but we know that sleep is related to the immune system. So, when we get less sleep, it actually results in increased infections and less antibody production. It also causes your inflammation to go up, the inflammatory cytokines, and will lead to cardiovascular and metabolic disorders. And these natural killer T cells that we had heard about. So not only does it increase your risk of getting infection from viruses, because these natural killer T cells get dysregulated, they go down. But you have an increased risk of getting cancer as well, because these natural killer T cells are roaming our body and they're looking for any kind of cancer cells. And on normal basis, they do a great job throughout your life. You may be irradiated by the sun, or you might have had some cells that don't divide well, and your body takes care of it all the time. But when you have sleep loss, you don't recover that function. And they showed in multiple studies that sleep less than 4 hours for multiple days reduced your ability to fight infections and cancer by 68%.
Wow. And
even in individuals that actually had followed up with more sleep, they didn't necessarily get back to baseline.
Wow.
So it's very important. I included another one that the colleges were putting up and promoting sleep. So what happens when you don't get sleep? Your judgment and your concentration are impaired. The release of appetite. You're suddenly more hungry. Your immune system is suppressed. Your emotions are heightened, causing irritability, anger, and anxiety, and your reaction time is slowed. I went back to the word brain fog because that's not a medical word, and I wanted to see how people were relating to that, and it's just a mental slowness. And we attribute a lot of those factors towards depression. It's perfectly fine to have those feelings of sadness, of depression, like you can't focus, like you don't have the energy. And the first step to recovering that is to reverse all the things that got you there. So whether it was a quarantine and isolation and losing the social connections, let's get back out there. Let's start moving, getting exercise, and start breaking those barriers. So that we can start enjoying life again. And some people, not necessarily because of those things. Some people had to face death around their loved ones. Some people lost individuals. Some people, this was the first time that they had a concern for their own health. So everyone will have to look at themselves, what has affected them, what has made them sad, depressed, and start looking at that, because you're the only individual that can correct that. And it becomes so severe that you would want to harm yourself. You need to go see your physician and talk about those things. And we need to increase those mental health resources so that those individuals have those resources.
Absolutely, and you did mention basically doing a self-assessment on how are we feeling and what are some potential triggers that may have gotten us here where we are currently right now. How do we feel right now? How are we maybe not noticing just those direct symptoms of physical effects, but also just the brain fog, for example, that you were mentioning, or the lack of energy to do the things that we usually enjoy doing it. So having that self-assessment, and I also we do have talk here in the channel about mindfulness, reflection, something that can really help with mental health, and of course definitely sleep and and all of that?
I think we're all connected. I think that was the first thing that connected us. And how did you handle the year? How difficult it was? Having those discussions with other individuals, what they went through, will make us connect to each other, will make us realize that we're all vulnerable to these situations, and will help us help others at the same time.
Yes, definitely. Now, doctor, going back to the T cells, so, and you did mention a statistic that was very shocking, that 68% of potentially developing cancer if we don't have the proper amount of sleep hours. So that's related directly with the immune system, correct?
Absolutely. So what happens is when you have high level of stress, or you're not getting sleep, imagine yourself studying before that test, or a night where you didn't get much sleep because you needed to prepare for something. You're already foggy at baseline. You don't really know what's happening, and you almost feel like you're getting sick. So that's the type of sleep loss that I'm talking about. But it has long-term consequences for your immunity that are harmful to the body, that can lead to increased risk of cancer, increased risk of viral infections. And some of us that have done 2 days like that will notice I got sick because I didn't sleep. So those are just some of the statistics. And then, before I finish, I just wanted to share some of the things that I read that were very interesting, that are coming out there in the medical community. It says loneliness and mental health during COVID-19 pandemic in older breast cancer survivors. They basically started with breast cancer survivors, and they just applied it to all women. And I can tell you some of the things that I was highlighting that I felt were interesting. So they were talking about the unprecedented psychosocial stress, and that loneliness has been identified as an independent risk factor for morbidity and mortality that is comparable in its effects to the mortality of smoking 15 cigarettes per day in cancer and non-cancer populations.
Wow.
Something as feeling lonely. And so many people felt lonely during that time. Even if you're surrounded by people, even if you're surrounded by individuals at work, you can feel lonely in a crowded room.
Definitely. And for example, even not living by ourselves, like you mentioned, we can still have those feelings of loneliness, and definitely all those consequences. You did mention about the alcohol consumption as well, or these with smoking.
There's different coping mechanisms that people have taken, and some of them of which affect adversely our mind. Just alcohol alone can affect your health, your liver, your immune system, your mood. So everything in moderation. You have to first find out what's causing this, and it's better to address the symptoms than to try to put a Band-Aid over it.
Definitely, absolutely. Treat them from the root, trying to make sure that we make those long-term changes so that we can also have those long-term effects, hopefully. Yes. Well, doctor, I think we have covered most of the things that we had discussed before. I think just one of the things that we definitely want to go back is to how important it is to go into a primary care physician, consulting with them. I don't know if you would like to expand a little bit more on that.
Yeah, so one of the things that we saw is that individuals were not visiting their physician. We're more afraid of the virus than perhaps their cancer or their cancer screenings. What I've seen now, especially as a pathologist that diagnoses people with cancer, that the diagnosis of cancer is that everything, what we're seeing in the hospitals now is higher staged. The cancer is bigger. As a result, the treatments and the interventions are more severe. And it's a shame. Some individuals decided not to pursue any treatment during the pandemic, dropped their chemotherapy. And that is just a compounding effect onto not only the mental effects, but their medical condition, and affects everybody around them. But again, these are some of the consequences of the things that we learned. We were, by force from the government, shutting down the hospitals to anybody, to the families, because we were trying to save them from the virus. we know in the Valley, if, you know, I heard from family members that, you know what, I'm not going to die alone in the hospital by myself.
I'd rather be at home.
I'd rather be at home and die alone. And it's interesting how we see families now, only one person is allowed. That's been an improvement. But we'll see them camping out there, and they'll bring out their chairs and support their family. Support, moral support is very important for an individual fighting whatever battle, whatever medical condition, and families are essential to that. So there's benefits and there's risks to everything that we've done. It's important to reflect back on those.
Definitely.
And say, this helped, this didn't, and
this we can do better.
Yeah, that we can do better.
You did mention about how family were camping outside the hospitals, and definitely, and especially here in the Rio Grande Valley with the culture that we have. We are mainly Hispanics, Latinos. We have very strong family ties. So definitely it's something, whether it's receiving a phone call or just having a visit at the doctor, makes a drastic improvement in our mental and overall emotional well-being.
Yeah, and that's the moral support that I'm talking about. People need to know that they're appreciated, they're recognized, and that they have a team of support. Find your area of support. After a year, more than a year of going through this COVID, you're going to find that your patterns, your behaviors have changed. It takes about 3 months, to form a habit. So you may be unwilling to take some of these individual actions, to go to a gym or to go walk outside, or to connect to others. You're going to have to recognize that some of the behaviors that you used to do are now completely different. You've formed other habits, you've formed habits where you're not wanting to be in social situations, but those are very beneficial situations. You're right, our culture, our area tends to have a great big family. We tend to visit individuals in the hospital in large groups. That's one of the things that I'm happy to see, even if they're outside. We saw the moral support for different areas, for nurses, for the hospitals, and you know, individuals passing by. Those are the connections that we want to reestablish.
No, definitely. And thank you so much, Doctor, for being here. I have had so much pleasure. I think we can keep talking and talking.
Oh, absolutely. Thank you for having me.
No, but thank you so much, Dr. Rudy. Well, thank you so much, everyone. Thank you for watching another episode of our Wellness Exchange series. We definitely invite you to subscribe to our Hidalgo County Wellness Program YouTube channel to continue to learn more about health and wellness topics. And we will be listing all of the articles that we had mentioned here in the presentation in the description below. Thank you so much for watching, and stay healthy. Thank you.
Thank you.